think we were going to give everybody a couple more minutes, but it looks like I see Commissioner Skaggs, Commissioner Steck.
Talon is here. You're just not seeing me today.
I don't ever see you. No, it's like you're absent. Talon, Commissioner Womack on yet?
Don't see him. Yep,
I'm here. I'm here.
Breevy and Jones on yet? We see Breevy.
I'm here.
Diane said she'd be a little late. So I think we have us all. Is it okay if we start, Wayman?
Yes, ma'am.
Okay, great. Well, welcome everyone, and I really apologize for the delay. To any members of the public, we did have a Board of Commissioners meeting that went a little over, so welcome everyone to the COVID Relief Subcommittee meeting for Thursday, November 19th. Wayman, will you please read the electronic guidance?
Sure. Pursuant to state statute 15.263A1A, the COVID Relief Subcommittee of the Kent County Board of Commissioners will meet today via electronic communications to protect the public health. Any member of the public wishing to listen to the proceedings or provide public comment may do so by using the internet connection or phone numbers and passcodes that are listed on the agenda that's posted. Closed captioning is available via an internet connection. Those wishing to provide input or ask questions in advance of the meeting regarding business to come before the committee may submit the input or questions to public comment at kentcountymi.gov. Anyone disrupting the meeting by using offensive language or actions will be removed.
Thank you, Wayman. All right, if we can move the agenda up. Thank you so much and welcome everyone. Again, we're going to move on to item 2 of the agenda, approval of the minutes from the October 8th meeting. Do I have a motion and a second?
Moved by Breevy.
Second by Ponstein.
Moved by Breevy, support by Ponstein. Questions or comments on the minutes? Don't see any hands. All right, all in favor say aye. Aye.
Aye.
Aye.
Any opposed? Doesn't sound like it. All right, we are on to number 3. I think staff has general sequence that they want to go through. So we kind of just left this pretty general in terms of relief allocation. My intention is we kind of see where we are in the bucket list, see what we have in terms of lapse and any status. We can ask any questions of folks who may be on the call in terms of status of programming. And I do know Jeff Dote, I believe, is going to run us through this quickly, but also I think somebody from the health department may be here as well in terms
They
of
are.
questions. And in the interest of time and knowing their total time constraint, if we need to bump them ahead, Wayman, let me know.
Yes. Adam, are you there on the call right now? I know you had 2 other competing issues. Are you there?
I am. Good morning, everyone.
Madam Chair, it would be great if we could have him go first.
Yeah, if no one's opposed to that, I'd like to have Adam kind of give us an update and we can ask our questions so he can get back to work. That'd be great.
Thank you, Chair, and thank you, everyone. So I think everyone knows that we are seeing a very significant increase in the number of cases here locally and for that matter around the nation. Right now, we're averaging each day between 500 and 700 new cases. That curve, which was flat through most of the summer, has now been growing at about a 45-degree angle for the past 6 to 8 months, or 6 to 8 weeks rather. During the summer, we were seeing about 50 new cases per day, which was a very easy number for our contact tracers, our case investigators to work with. At 500 to 700 numbers, we are.
He's muted. Get it back.
I'm unmuting.
Okay, am I unmuted again?
Yes.
Yeah, sorry.
Someone was censoring me.
No.
It was me. being by accident. I'm sorry, Adam.
That's okay. Thanks, Pam. We're now seeing an average of about 5 deaths per day. We had 16 deaths reported to us yesterday, which was our single largest one-day number. And we're at 263 total deaths. Right now, our local hospitals are reporting about 300 admitted for COVID right now. About a quarter to a third of those are in intensive care. And the hospitals are reporting that about 10% of the people who nationally, who are admitted for COVID, about 10% of those don't survive. So we know that we have a challenge in front of us. We know we have a dark couple of months ahead of us. We have been communicating that as loud as possible and have brought in many others to communicate that as well, and especially with those core prevention messages. And right now, everyone is increasing their messaging around the holidays. I think, of course, we're all concerned about Thanksgiving. Just looking forward, that Christmas, New Year's Eve combo is really frightening for me. I think those two holidays within 1 week of another, people traditionally hang out with different groups, Christmas and then a different group on New Year's. We can't have people do the traditional thing this year, or we're really going to throw some gasoline on this fire going into January. We are expecting with eager anticipation to go on offense here in the near future with vaccine. We are equipped right now to receive between 100 and 200,000 doses of the vaccine if it were ready today. We are adding additional freezer capacity so that we can store more doses. We'd like to be able to store 500,000 or more. We expect that we will be a regional hub for vaccine storage. We have capacity here with our freezer space that other health departments and other providers don't have. And we are working very carefully right now to plan with those healthcare providers, with other providers of vaccine in our vaccine provider network to make sure that we can use a push strategy as much as possible, which means we receive it as much as possible, and then we push it to partners. The challenge with the Pfizer vaccine is once it's brought to room temperature, it needs to be used within 6 hours. And so that's why this planning is so critical. We can't afford to waste vaccine that doesn't get used quickly. And so we are doing that planning right now. Testing is also up. We have about 4,000 to 5,000 tests being done every day of Kent County residents. The challenge is that nationally we're seeing severe limitations in some of the reagents that are required for some of those testing procedures. We are expecting to get more of the rapid antigen tests. We've got about 6,000 of them now, which is not nearly enough. The state has pushed them to long-term care homes and skilled nursing centers, and that's been helpful for them for their surveillance. But we really want to get more of those rapid tests here so that we can partner with schools, with other healthcare providers, first responders, to make sure they can do that kind of surveillance in a timely way as well. So lots going on, of course. I'll stop there, and if you have any questions, I'm happy to field them. We also have Gail Brink on the call who can answer any questions you may have about our finances.
Adam, I did mention this in full board, and you touched on it a little bit, but in terms of people are asking why is the testing taking so long, and why aren't you putting more resources into it, and why aren't you doing that? I can attest just with my day job. It's not that we don't have the staff resources or the machines or the staffing to administer the test. It's that we don't. There is a national shortage, to my understanding, of a couple of the vendors that use the equipment. Specifically for my employer, there are these things called tips that we need to operate one machine, and there's a reagent that we need for another that nationally no one can get. So when you have to take those machines offline, it automatically creates a longer, a longer time to get your results, a longer time to take the test. What is the thought on, I have some people who say if I have to wait 5 days to take the test and then another 5 to 10 days to wait for my results, why don't I just go isolate and not even mess with it? What is your opinion on that?
Well, I agree with that. And that's one of our heightened recommendations that we're going to be making within the next couple of days here, is that right now we're not seeing much prevalence of other infectious respiratory disease. We're seeing influenza numbers are very low. Other respiratory illnesses are very low right now. So we believe it's wise at this time that if you have these symptoms, that you should assume that it is COVID, contact your provider, get tested, but assume that it is and isolate yourself. We're also going to be recommending that in accordance with new CDC guidance, that people who are sick at home should be masking. And if you have someone with those symptoms at home, you should be masking as well and trying to do what you can at home to limit exposure.
Do we need to maybe do a little bit more in terms of getting that message out? I know I was ill a couple of weeks ago and I didn't know if it was COVID or not. So I kind of isolated myself to an area of my home and kind of did that same thing. But do we need to do more in terms of maybe getting that message out there?
We do. And it's more than the health department as well. And we had a great meeting last week with other healthcare leaders and business leaders, and had this conversation about really bringing all of our outreach and communications weapons to the front right now, and sharing that message along with all of the other prevention messages. I think that there's a significant portion of the population who has heard this from people like myself and from public health agencies. I think they need to hear it from other leaders across the scope of life. And maybe that will resonate with the few who are still reluctant to take this seriously.
And then real quick, and then I know Commissioner Skaggs has his hand up. Sorry, Commissioner Skaggs. But just real quick, I wonder too, just to confirm, and maybe I know this changes daily, but it's not an issue of us not putting forth enough CARES funding to get these testing supplies and get the staff. It's the fact that there is a shortage of the actual material to go purchase, correct?
That is largely correct, yes. We have, so to speak, we have troops in the field right now. We're just waiting for gunpowder, and others are doing the same thing. There is a national shortage of testing supplies, once again, like what we had in the springtime. And that's a national and really an international problem right now.
Yeah, it's like going to the grocery store and you have the money to buy, the toilet paper. You just can't find the toilet paper. So that is the issue. It's a supply issue.
Yeah, we are starting to see some new testing technologies come online and coming to scale, so that we can start to use these as well, like the saliva test kits. And so we're hoping to diversify the types of tests that we're using. Unfortunately, it would have been ideal if all of this planning had been in place and all this production capacity was in place in advance of a pandemic coming.
Commissioner Skaggs and then Commissioner Steck.
Good morning, Adam, and thank you for that last comment. I just do know that we had some talks previously at this committee about making sure that you had the money to implement a vaccine distribution, and so thanks for the update on that. So what I'm hearing from you is that we're in the process or have purchased some more refrigerators to be able to keep these vaccines functional. I know some of them need to be at a pretty low temperature, as you mentioned. Do we need any additional funding on the vaccine front so that, if we can make it through this, as many of us can make it through this dark winter, that by the time we get to vaccine into public distribution, that we can do that as quickly and efficiently as possible. So is there anything that you need from this committee or from the commission at large?
Between now and December 31st, I don't believe there is. I'll let Gail speak to that also. But we have the refrigeration. We have more units on the way. The purchase orders are out there. The devices are en route. We also have purchased 2 mobile units, which are going to help us mobilize our distribution. I think the challenge that we're going to have is that we're not really going to see this vaccine distribution effort come to scale until early 21, after these resources are no longer available to us. So I think that that's where we need to be thinking about how do we make sure that we have staffing, and we have the things that we need for the long game in 21 available to us. Gail,
But everything that we can buy now, that hopefully that we might need later, we are buying now. Is that
is correct.
That's where we're at. I mean, I'd rather buy one more refrigerator than we ever need than turn around and find out in 2 months that we don't have enough refrigeration. So you talked about 500,000. That's good. But we've got the refrigeration and whatever else it is that we need to be able to have those doses ready. Anything that we can buy now, we are buying.
That is correct. And in fact, I think those units, once they're installed and once we figure out how to more effectively, that 500,000 is actually a low number. I think we can get above that. In fact, I don't want to be too optimistic, but I think from what we're hearing, you may actually be able to double that number. But that's going to be more than what we need at any time, because we're going to have a flow of distribution as we use those doses.
Great. So the big issue will be staffing to deliver them.
Correct.
Okay. Thank you, Adam.
And
Thanks,
Adam,
Jeff.
just to put a fine point on this, again, on the vendor issue, we don't have like any special treatment. It's everybody is purchasing these at the same time. So maybe one location gets a shipment that would have come to us, but it came in their order queue a little bit earlier than we did, or whatever. It's not like we can leapfrog their order system, or there's no way to continue to push on getting these supplies, correct?
That is largely factual. However, we do have Cal Brinks, and he is a bit of a magician with this. Truly.
True.
And we also have Al Jano, who him and his team are fantastic with getting these things installed and mobilized. So
Right.
we have those things that are truly advantages for us. But largely speaking, yeah, the whole world is demanding these supplies and these pieces of equipment.
Right. Commissioner Stepp.
Thank you, Chair. Well, Commissioner Skaggs raised one of the questions I was going to ask, but a couple of others. My understanding is that the current mitigation response strategy is testing, identify, and then contact tracing to be able to isolate as best we can. With the numbers that you're looking at now, 500 to 700 positives a day, that's an incredible challenge for contract tracing. And that's a very staffing intensive kind of function, as I understand it. Can we use some of the current funding we have available through this CARES to help supplement that? Is that a strategy that's worth pursuing?
So we actually have quite a significant amount of money now for contact tracing and for bringing in other vendors and temporaries and others. And I think we have trained about 200 people, and we have other vendors that are doing that work for us as well. Gail, maybe I'll talk to that in more detail. I think that the challenge that we have with these numbers is doing it in a timely way and getting people to have the information they need so that they're not waiting for a phone call from the health department to know what to do when they get that positive test result. And that's what we're scaling up to do now and changing our messaging so that people aren't waiting for a phone call in order to know what they need to do for isolation or to contact their close contacts and let them know that they should be in quarantine and maybe think about getting a test themselves. Gail, do you want to talk to us for a moment about what we've done to bring in additional resources for contact tracing and what we might need going forward?
Sure. We have currently several different contracts for with outside agencies to bring in staffing. We have a temporary staffing. We've also have partnerships with some of our community partners in the populations where we were seeing a higher incidence of COVID positive. We have a contract with the Black Impact Collaborative, who provides us, I think we're up to about 20 or 25 contact tracers from them as well. As Adam said, we probably have between health department staff and contractual staff at any one time, probably 200 staff doing contact tracing. And not only do we have, I want to point out too, not only do we have the contact tracing funds that are available through the CARES Act, as you see on the spreadsheet, we also have about $2 million of funding from the state for contact tracing as well. And some of that will take us past December 30th. So that's a good thing that we can continue to do that. It's just even, it's pretty hard to, even if you threw 500 people at it, when you're getting that many cases a day, it's very, very hard to keep up with that.
Yeah, and I certainly appreciate that. That's why I look at it and scratch my head. How could we possibly contact trace 500 to 700 cases a day? That's just a huge challenge. But it also strikes me that the prophylactic effect of contact tracing requires timeliness, right? I mean, that's really a critical part of that. So if we need to flex out even further through additional funding, and following up on Commissioner Skaggs, ask, please, and we'll do what we can. But that seems to me to be critical. So the other question I want to ask a bit on the vaccine, is the Pfizer vaccine the only vaccine that we're essentially planning for? Or, because I know there's a couple of other candidates out there, and each of them have their own unique requirements to be prepared for.
The Moderna vaccine will, we believe, will arrive shortly after the Pfizer vaccine. We expect the Pfizer vaccine to be available first. And the state recognizes that because of its very challenging storage requirements, that they can't simply push it to counties all over the state, because many places just don't have the infrastructure to handle that. So they will be largely pushing that to hub locations like Kent County that does have that infrastructure. And so I expect that we're going to be getting, and also it comes in larger shipping units than the Moderna vaccine is planned to arrive. So the Moderna is going to be more effective probably for some of the smaller, more rural counties that can handle its easier requirements and have smaller sized clinics that they'll be offering, where large counties like us will probably be getting Pfizer up front.
So if assuming the Pfizer is where we're going to go with this, and we're basically going to be a regional kind of provider for that, who pays for the vaccine? And at the time of administration, is that going to be cost neutral or no cost to the recipient?
That will be no cost.
So we'll be buying it.
It will be provided to us by the state of Michigan.
Okay, so the state pays for the vaccine, and your understanding, and it's just distributed by the state?
Yeah, I'm not sure if the state is paying for it or who, whether it's the state or the federal government who's paying for it. That's not detail I'm privy to. Gail, are you familiar with how the money moves between those levels?
I believe it's a federally funded vaccine that will come to us at no cost to us. I don't think there's a cost to the state of Michigan either. That's my understanding.
Good. That's probably something we want to nail down. Obviously, we don't want to end up with a huge bill, at least not having planned for it. So.
Yeah, we're certain, and we have been told that it won't be our cost. It's just, what we're not 100% sure about is if it's a state cost or a federal cost, but I believe it's based on what the state is telling us, it will be a federal cost that's just sent with no cost to the state or to us.
Okay, thank you.
Any other questions for our amazing health department before we let them go? Mr. Ponstein.
Thank you, Chair Bolter. Adam, just a quick question, clarification. I'm reading some of the chat and the people I talk with that Kent County's not doing enough for testing. We're not the only one doing testing. I'm assuming Mercy Health does it, Spectrum, and a whole gamut of others. Is that a true statement that we're not the only one testing?
That is true.
Okay.
The hospitals are testing. Cherry Health is testing. Some local pharmacies are testing. There are a number of other providers out there that are doing testing as well. And in fact, there are laboratories that are opening up their own testing locations as well. Helix, NextGen, Arctic. So we've got some testing that's been going through the schools. So yeah, we are very much a diversified community in terms of the places that people can go for testing.
And I think just to add to that, keep hearing people that takes 5-7 days. I know when I was tested, it was within 2 days with the results within 2 days. And that was through Mercy Health. So, there is a lot of misinformation. I just think we've got to, like if I've always said, is messaging is key. And, we've got to pivot, especially now that we can't trace everyone, is that we've got to make people, if you think you've got it, this is what you've got to do.
Okay, any other questions or comments for Commissioner Jones?
Thank you, Chair Bolter. So Adam, I wanted to talk about, because I know it's come up, I brought it up at executive, it's come up with Commissioner Steck, it's come up with other folks that I've been in touch with even via social media. Can you touch upon the length of time for quarantine?
Sure. So it depends somewhat. Quarantine, generally speaking, is 14 days. And that's based on the maximum period of time it takes for virus to incubate in a person to cause infection. And so generally speaking, quarantine is based on 14 days from your last point of exposure to an infected person, to a case. And so if someone was within 6 feet of you or had physical contact with you and they were a case, you'd be notified about that, and you would can quarantine from 14 days, starting at the moment you left that person's proximity. Where it gets a little bit tricky is where the initial case is a household member, because that person will be infected for a period of time, probably about 10 days, where they can pass it on to others. So if I'm a case in my house, my children and my wife in the house with me, their 14-day clock doesn't start until my infection has passed. So their clock doesn't start until I'm at about day 10 after my symptoms began. So it can be, for some people, up to 24 days, and sometimes more than that. Because if I pass it on to my son, who then has it, it might be even longer for the other people in my household who aren't sick. So it can be difficult for household members. But generally speaking, it's 14 days.
And I think that's the part that can be communicated more clearly where we can. I don't know on the communications team side where that gets into the mix, but that's certainly an area that I know has been a point of confusion out there. So I just wanted to call that to your attention, that's what I've been experiencing when I get questions. I know it's an awful lot to lift, and I am so grateful for you, your leadership, and everything that you've been doing with your team. So thank you so much.
Thank you, Commissioner.
Any other questions for the health department before we let them go?
I have a question, if that's possible.
No, we aren't taking public questions. This is a subcommittee meeting, unfortunately. We can take your questions in chat, or we can take them during public comment. But we won't be able to do that in the subcommittee meeting. And if you leave your information at public comment at kentcountymi.gov, we can get back to you that way too. Or if you leave your contact information in chat, we can do that as well.
Okay, I can leave my question in the chat.
Okay, and let us know how to get a hold of you. Thank you. Any other questions from subcommittee members today? Seeing none, thank you, Adam. Thank you, health department, staff, everyone. Appreciate you. Please keep us informed, and we will move on.
Thank you.
All right. Is Steve going through this, or Jeff?
Yes, Steve will take us through real quickly on the buckets review, and then Jeff will take us through the balance of the update.
Great.
Good morning, Commissioners. Up on the screen, you should have the bucket report with the information through November 13th, 2020. This is the first bucket report that will show all of the $114 million that has been allocated through the subcommittee and the Board of Commissioners. Later, Jeff will cover some of the key categories in more detail. I'm going to highlight the report at a high level. County expenses, the two things I would point out is that the county expenses were increased from 35 million to 38 million 428, which is the expense total in the fourth column for the budget. The addition were $2 million additional for the health department, $1 million to cover single audit and recipient monitoring, and $428,000 for either public safety or health that were all approved by the board. Most of the categories in the county expenses are pretty self-explanatory. The one it continues to have a large number and continues to grow is the last one, the various unallocated. At this point, if you look at the total in column 3, you'll see we have about $8.1 million in that category. Any question about the county expenses? Okay, moving down to the business expenses or business assistance. The big change in that one is if you look at the budget in the fourth column, it's climbed from 25 million to 34,250. Again, program increases authorized by both the subcommittee and the board. We moved $5 million in to assist closed businesses. We put in $3.5 million to expand the small business program. And we transferred up from the child care number of $750,000 to assist for-profit child care. In a total, we've spent about 27.7 million in the business grants. It's column 3. We have 6.6 still committed to the program. That program's ongoing, and we expect to see some more costs coming in it. We have nothing on business assistance. Mitigation of homeless is the next category. I believe there's not much change in that area, and I believe Jeff will touch on that somewhat after I've done my presentation. Vulnerable population. Again, second category, the not-for-profits. If you look at the third column, we have either expensed or encumbered about $9.4 million. Virtually all that money has been spent. If there are no questions on vulnerable population, I'll move down to some of the other categories really quickly. We have compliance with public health orders that deals with the boardroom we want to have at the boss, and not any activity there at this point, though I know Al Janel has done some research on it. Internet access is still out there. Again, at this point, we've got about, if you look at the third column, about 310,000 of that either expensed or encumbered. Going down to school assistance, we increased that from 2 million to 3 million. Essentially, if you look at the third column again, almost all the $3 million has either been expensed or encumbered for that activity. Local units of government, again, virtually all spent. If you look at the third column, about 14.9 is already expensed or encumbered. And then if you look down at the next one, Convention Arena Authority, third column, again, virtually all spent, almost $2 million. We get down to the bottom, which is where we wanted to be, no reserve left. All the money has been allocated. If you look at the total CRF line, which is the last one, the committed amount remaining is about $19.5 million. The only thing I want to point out is that 19.5 ready for reallocation? No, we will continue to have expenses coming in through the remainder of the year. What that number is likely to end up, I can tell you it won't be 19 million, but I can't tell you exactly what that number will be. Unless you have any questions, I will turn it over to Jeff to get into some of the other details.
Do we have any questions for Steve on this document before we move on to Jeff?
Chair, it's Skaggs. I have a question.
Yep.
So on the bottom there with the unit of unallocated is 141,000. I know that there was at least one township that's decided not to use the money. Does that mean that, you know, the original allocation that we made to the various cities, villages, townships, etc., that most of them accepted that money and then found COVID-related uses for that money?
Yes, that's correct, Commissioner Skaggs. Yes, there are two, I believe, now that are in question. I think there's only one now. There was one that was questionable. I think we got back information yesterday, but there's one township that's right now not accepting out of all of them.
Okay.
And to answer that,
Great.
I don't know if Linda's on, but I did get a call earlier this week that we still just hadn't heard back from some up or down, whether they were going to take it or not. So I did have to track down a couple of my local units as well. So it may be a situation where sometimes when you're dealing with part-time offices or spam issues, they're not getting the initial correspondence. So we do have to follow up, and I hope that we continue to do that. But I do know that as of this week, there were several communities that we were still just trying to do our initial contacts with. So
Sure, if I could,
Sure.
we did go through the list, and we've reached out to all of the commissioners whose districts include any of the municipalities that had not yet responded. So we're working with the commissioners, and I have talked personally with several of those units in the last couple of days. Sure enough, to the chair's point, some of the original emails apparently went into unchecked folders at various townships. So we're rectifying that as fast as we can with each individual township.
any other questions, Commissioner Skaggs?
Just that overall with the major population centers, they have accepted their allocation and have spent it on the proper COVID-related expenses. That we can say.
Yes, sir.
Yes.
Yeah,
Yes.
so far,
Great.
if I may, two entities have officially declined, totaling about 400,000. Some of that's recent. That's why these numbers still need to be updated. But as of now, those are the only two.
Thank you all.
Commissioner Steck.
Thank you, Chair. Speaking of updating, I know that we just released a press release about the youth violence allocations. And I see we still have $1 million here unspent. That's without calculating those awards that are identified in that news release.
That is correct.
Okay.
We'll talk about that a little bit more in a second too.
Oh, okay. I'm sorry. That's going to get addressed later. So the other thing, going back to the small business, there's about, I think you said 6.6 million unspent yet in that. And I see Dante is on the call. We still comfortable that we are going to get that money pushed out the door, or is there something that you're suggesting we as commissioners can or should be doing to make sure that that gets done? I know it has nothing to do with the fact that there's no, I mean, the demand is incredible. So it's more a method and process of getting the communications out there. But
yes, we still feel very strongly this will get out. I do have an update for the committee at large.
Do we want to do that now? Is that amenable to everyone? Dante, if you want to give us a quick update on that, status of that.
Absolutely. Pam, can you share the document I forwarded you? So I do want to provide an update on what has been submitted for or recommended for funding. There's a lag, I think, from what you see on the spreadsheet to what is in the pipeline, so to speak, already ready to have checks issued and so forth. So this is the update you will see. As indicated by Steve, we do have 4 buckets of funding. The original 25 million for the 0 to 25 full-time equivalent employees. Those businesses closed by the executive order as of August 1st. We allocated, or you allocated 5 million there. Childcare provider, 750,000. And then the last adjustment that was made for businesses, or to include businesses with 26 to 50 full-time equivalent employees, 3.5 million. As of this week, that has been submitted to county staff for final approval and disbursement. We have under the traditional bucket, the 0 to 25 FTEs, 3,166 businesses have been approved. 1.2 million is still available in funding. Under the closed businesses, 185 businesses have been approved, and 940,000 is still available. Under childcare, it's 106 businesses that have been approved, and there is $1,000 left still available. However, these businesses can still apply under the traditional bucket as well. And then under the 26 to 50 full-time equivalent employees, 48 businesses have been approved, and 1.68 million is still available. So total available on our end is $3.82 million. Total applications received since June 22nd, when this program went live, 4,708. Pam, if you can scroll down a little, I want to give a brief update on the demographics. 55% of all recipients have been people of color. 39% have been women. And then I broke down the ethnic demographics with 38%, of course, being white Caucasian, 27 African American, 9% Hispanic, 8% multiracial, 7.83% Asian, Middle Eastern, and Native American, as you can see there. We do, as of November 15th, there was a provision in the last modification of the contract that allowed us to, come November 15th, allocate these different buckets of dollars to where they are needed the most. One of the pieces we're bringing forth that we plan on doing or would like to do is to support the industries that are impacted with the most recent health order announced on Sunday. That took effect, as everyone knows, Monday, first thing Monday. And since then, I have had 3 different conversations with different groups. One is the Michigan Restaurant Promise that has many Kent County restaurant and bars that are part of that. Another group was with the Rapid Growth Media Restaurant Group, a committee that they've formed. And all of these businesses in these very difficult times and discussions that we had with them, they're all saying the same thing. They, because they were operating at 50% capacity or less, they weren't making money, they were struggling, they were barely staying afloat. However, this executive order is really going to limit their chances of being able to come back strong. We ran some numbers and identified that of the businesses that we have already supported that would be part of these industries under this new executive order, we identified a little over 300, actually 311 businesses, restaurants, bars, et cetera, all these that have to close right now. If we were to fund them at a fraction of what they were funded already, This equates to about $3.5 million of funding that could go out to these very much needed support for businesses right now, for these businesses. That would leave us a few $100,000 to support any new and incoming applications. I will say that applications have dwindled from an average of about a couple hundred or more a week. Now we're in the double digits, 60, 50, 60. And that's giving that we have a team of chamber staff and contractual staff that's out there every day knocking on doors and pinpointing areas that we don't have applications from, geographic areas, and being intentional there. So it's a very active outreach campaign that we're still doing. However, the numbers are dwindling. And we feel that this allocation makes the most sense right now for us to go back and support the businesses impacted by this executive order. The majority of these were supported very early on, 5,000, 10,000, that's where the majority are. However, we didn't expect this to last this long. We do, as Adam London mentioned, there's light at the end of the tunnel. We can see now that come the first quarter of 2021, as the vaccines go out, the numbers come down and consumption goes up. Every economist will tell you that the time after a dip like the one we're having now is seen with very, very robust growth. But it's hard to do that if the business don't make it to that point. So if you scroll down, Pam, a little more, I do want to provide at your leisure. I don't know if it's not coming up.
See anything here?
It's not coming up. You might have to reshare screen or one of those, but just for your reference, I included about 8 video testimonials that we did, that we use as marketing tools to get the communication out there. Pam, and you're going to forward this document to all the commissioners, correct?
Yes, I can do that.
So please, I encourage you to click on each one just so you can see some of these stories. And then following that is a list of written testimonials or emails that we received thanking us and the county for this work and what it's meant for them as businesses. So to wrap up, 3.82 million still available. We feel that we can support these, we can provide additional support to these industries that are now being impacted again and close out our work. It's amazing that this started June 22nd, and now we're at the tail end of this. So
thank you, Dante. I also want to kind of echo. I hope we do get to see those thank you notes. I had to run into the office the other day to sign a bunch of stuff, and Pam put this huge folder on the table, and I really didn't know what it was, and I started going through it, and it was a stack of thank you notes to the board from businesses. I stopped in yesterday to grab to go for lunch, and she just said she thanked me, and then she said thank you for keeping me open. And so Pam, I'm hopeful that you can scan all of those and send them to the entire board so they know that kind of we are hearing from the community, just because we're not physically there and it would have been posted on our board behind the chambers. I would like to make sure that all of our board members see that. So with that, are there any questions for Dante before we move on? Commissioner Callan and then Commissioner Skaggs. Commissioner Talon?
I'm going to pass. Thank you.
Commissioner Skaggs?
Thank you, Chair, and thank you, Dante. I guess I would prefer that, given that the recent order just came out on Sunday and I think was in effect on midnight on Tuesday, Wednesday, that maybe we give folks like a final week to apply as opposed to pushing this money to businesses that have already received funds, those 311 businesses that you mentioned. Obviously, we've got a lot more restaurants than that. I think it's just vital that we, obviously, I think this is the right measure for public health. We're not flattening the curve. It's not horizontal, it's more vertical. And that we need to keep these businesses afloat to, again, get through the winter and to the vaccine. But I think an all-out push, nothing impacts people like a deadline.
Yeah.
And we haven't been able to give people a deadline, because, it just hasn't been a reasonable measure to take. But it sounds like we're coming up on deadline period.
Yeah.
That this money could be sent out to the 311 that have already had it. But I just want to give some of the businesses, I know I've talked to some just recently in my district that didn't put in before because they felt that they weren't suffering, that they were able to get by. But I know that they're hit pretty hard here because, again, when we first went into this, I think it was 15 days to flatten the curve. And now it's 3 weeks to make it through. And I just, 3 weeks can become 6, can become 8 awfully quickly. And I know that we want to give, every opportunity. I appreciate all the work that you guys have done, but I think if we could just give a deadline of a week,
Absolutely.
that then we can feel like everyone had the opportunity to take advantage of it.
Commissioner, thank you for the comments. That's exactly the plan. We do plan on promoting and getting it out there that this is coming to an end, urging everyone to apply. And we still will continue to have our outreach team still out there, knocking on doors and helping them understand that, we're days away from closing this down. You need to apply right away. So yes, that's part of the plan. Thank you for those comments.
Well, great. Had I known that, I wouldn't have gone on for that long. But do we have an actual date then? Have you guys come up with that? Or can you let us know as soon as you can so we can get it out to our people?
And just to share with everyone else, our thought of funding these 300 and plus businesses is not an automatic, okay, here's an additional funding. Everyone will get a specific email with a link, letting them know that there may be additional funds for these industries, for these businesses. Click on the link, update your application, and let us know, are you still in business? Will you still be sustainable, given this new health order afterwards? Are you going to come out of it, and so forth? And this will allow us to then allocate per business and work with each individual business. That will help us determine the time frame that this is going to stay open. But we will give a week's notice when we're ready to close it down.
Okay, thank you, Dante.
And Dante, when you get that deadline, will you include us so that we can kick that out to some of our contacts as well? And additionally, I know Commissioner Jones mentioned this, and I know she's got her hand up, so I don't want to steal her thunder, but I also am hoping that you can ensure that all of our local chamber partners are really pushing this out, because I haven't seen a lot of that. And I don't know if we need to contact them again and make sure that they're kind of upholding their end of the bargain here, but we need to make sure that they are really pushing this final push to get that word out locally. And again, I haven't seen that. I haven't felt it in my community other than from what your efforts are displaying. So I'm really hopeful that if we need to contact them or if you do, but I would like to see their efforts bumped up a little if possible.
And I'll share with the subcommittee that it's only a handful of chambers that are really supporting this and what I feel are really out there doing what's right for their businesses.
Right. But we did create a agreement with them, and we need to make sure that those organizations are upholding their side of it. So, Commissioner Jones.
That is exactly what I was going to cover, and I appreciate you bringing it up, Chair Bolter. Just the one step further than that, I would really like to just have an email back from each chamber that received funds with not anything that is more than just a bullet point of what they have done since receiving their funds to help assist with this. I think that's an accountability standpoint that is something they should all be able to manage. And if they don't have enough depth of those bullet points, they right now still have time to create those bullet points. It can be as simple as we sent a mailing to our entire, membership list with the details of this. I actually would feel like we need to have that extra accountability, because it wasn't, it was significant amounts of money to these chambers that went to assist with this. And I think that's a reasonable request to consider having them do.
Yep.
Thank you.
And Wayman, I don't know if that needs to come from you and not Dante, but I think.
That'll come from us.
Yeah.
Okay.
Thank you, Madam Chair. We'll make sure that happens.
Yeah, Chair,
Okay.
this is Jeff. That was actually written into their agreements that they need to do periodic reporting. A few of them have already. We need to reach out to the rest of them. We're working on a survey for that very thing. So
Sure, they might just need a friendly reminder.
a little reminder. You're right.
Okay.
Thank you much.
Thank you.
Sorry.
Yeah, thank you, Chair. I just wanted to follow up clarification on Dante's response to Phil's inquiry. As I understood it, Dante identified 311 of the businesses who have received funds are now impacted by the new closure orders. And so we're looking at reprioritizing some of our existing or remaining funds for those businesses. And I think what Phil was asking, what I was also would ask is, are the rest of the businesses that are affected by the new closure orders going to be prioritized because they are perhaps more at risk because of the new closure orders?
So those that have been impacted by this new order, most of the business have applied already. And might have been in June, July, August, throughout the last few months, with over 3,500 businesses applied. There's a lot of those. We know that demand, so to speak, is dwindling, because every week it's less and less applications that are coming in. So we pretty much have gotten to anyone who's really needing this out there. However, we still want to leave it open until they're fully exhausted, right? These 311 businesses that we've identified meet the criteria of the industry. We're still going to reach out, or they still need to get back with us and let us know, yes, this I am hurting. So it's not a full application, so to speak, but an updated on where they are at, and then that is used to determine, do they get additional funding, and so how much do they get?
Yeah, I guess I just wanted to make sure that, because I too am aware of some businesses that didn't do the process earlier. Typically the small business we can get through, we'll make it, and then they got hit with the most recent set of closures, and they're in a different place now. I just want to make sure that we're reaching out to them as well. You don't qualify just because you applied before, so that we do hit that full spectrum.
Yep, absolutely.
Any other questions for Dante? Commissioner Skaggs.
Just real quick, Dante, that also picking up on Commissioner Steck. So correct, as in the most recent DHHS order.
I'm sorry, I cut out.
You froze. You froze.
The impacted businesses. Sorry, can you hear me now?
Yeah, we can.
The impacted businesses do include restaurants, right? It's not just
restaurant, bars.
Okay. Okay. And so good. So this money will be directed, the remaining 3.8 million pretty clearly towards brick and mortar stores.
Correct.
Okay.
Correct.
Great. That makes perfect sense to me. Thanks a lot.
Any other questions for Dante before we move on? Seeing none, Dante, thank you, thank you, thank you.
Likewise, thank you.
So appreciative, and we will be following up with your other chamber local partners to assist in getting the word out. Thank you.
Commissioner, and expect to have a press release go out today, and we'll forward it on to other commissioners on the strategy to wind it down.
Perfect. Looks like Commissioner Talon has his hand up.
Thank you, Chair. I had wanted to ask this pre-Dante, but it's back to the total spreadsheet that we were looking at, and Dante's piece fits into this. I know Steve said we don't know exactly how much is going to be left over, but I guess I would be looking for some sort of estimate based on what we think is going to be spent, what we're looking at there. And I haven't heard that, and maybe that's something that we'll be hearing later, but I want to make sure that number comes out at some point.
I'm going to be covering that, I think, right now.
All right. I thought it might be coming from Jeff. Thank you.
Are we ready to begin, Chair? Ready
Yes,
to move on?
please.
Okay, so I'm going to kind of take us through Steve's spreadsheet. I'm going to skip the county expenses for now and go to the business assistance. I'm going to try to give us an overall flavor of where we think we're going to end with all the allocations. So if we start with the business assistance, you heard from Dante, we believe the chamber will fully spend their grant funds. I heard from Cal that the business PPE program is again picking up with the second wave. So we hope to spend most of those dollars out, and that technical assistance will have a small carryover of the $60,000 that we do not feel will be spent. The mitigation of homelessness, we heard this week, the Salvation Army, we originally allocated them $1 million. They have informed us they do not have the capacity to spend the second million allocation to them. So that second million will be returned to Kent County. Staff is working on a plan to spend that down. One of the things we think we can do is reimburse our own KCCA, about $550,000 of that. So their funds can be put back in the bank, so to say, and expended into 2021 because they don't have the same deadline of 12/30. So if that works out, we still may have some lapse in part of that million, but we're working on spending those funds in that category as well. If you go to the vulnerable populations, you see the $1 million in crime prevention, $500,000 of that has been awarded. We also heard this week that Grand Rapids is returning $500,000. And we're not sure 100%. Actually, I have a recommendation, all these leftover funds. So we feel that'll be in that category, you know, 500,000 to 600,000. If you go with the compliance with health orders, we feel like most of those will be spent down with the internet access. There's an additional plan to spend some of those dollars. And again, the bottom category there, the schools, we feel like we're going to spend most of that. The local units of government, I think right now it's looking at about 400,000 will be returned. And then the Convention and Arena Authority didn't quite take the full 2 million, but that's a small amount. So overall, we originally, if you recall, left $20 million for a second wave, potential second wave. You know, a couple of months ago, we realized we're getting, you know, later in the year, we need to allocate some of that. So it went to good uses. So we allocated most of that 20 million, and now we're finding with this late surge that county expenses are coming in a little higher than we anticipated. So, and since that point, in the last couple of weeks, we've had additional requests. However, looking at the total allocations and the amount we feel that's going to come back, I think the prudent thing is, and we've talked this over with staff and the departments, is to return the unallocated pieces to Kent County for future expenses through the end of the year. That would be our recommendation. And if it's the will of the committee to do it that way, we could do a motion today that can go to Finance and Physical Resources Committee in December, and then the full board to allocate any remaining dollars of the CARES funds to the county expenses. And with that, I'd be happy to answer any questions.
Any questions or comments for Jeff?
Yeah, this is Commissioner Steck. I have a
Steck?
question.
Yep.
Jeff, you stepped over that fairly quickly, at least quickly for me. The $1 million that we had allocated, the second $1 million we'd allocated to Salvation Army, as I recall, was principally eviction avoidance programming.
Correct.
And is your suggestion that that be shifted over to KCCA because they also have eviction avoidance programs in place? All of it or some of it, or?
We're looking into, so far we've got a number from them that they've spent approximately $550,000 on eviction prevention this year. So we feel like we can reimburse those funds to them. And then in essence, they would have that money available to spend in 2021 towards the same program without the 12/30 deadline of CARES funding.
So that would be 500 of that million.
Yeah, just about 542, I think was their number so far.
I'm just wondering if there's, and I'm sure you've explored that with Susan, but
we have.
We can certainly anticipate that with all of the eviction abatements starting to run, that we're going to see that issue become more and more significant.
Right, and that's why we thought it would be helpful to be able to expend some of those funds in 2021.
Yeah. Well, it'd be nice if we could shift it all that way, but I understand the rules are the rules at this point.
Yeah, correct.
Any other questions for Jeff?
Chair. It's Jim.
Commissioner Talon?
Thank you. Jeff, I didn't hear, I'm a little bit confused yet. I didn't hear an exact number that you're suggesting be rolled up, and it wasn't clear to me where it's going to get rolled up into, and I can't see the entire spreadsheet. Wish we'd have had it in advance. Are you talking about rolling it up into that top category of Kent County expenses?
Correct. We would roll it into the Kent County category of expenses. We feel we can allocate any and all additional funds that would be left over to county expenses and still be in compliance with the CARES Act with the 12/30 deadline. We feel like it's going to be $500,000 from the city of Grand Rapids, about $400,000 from local units, maybe $450,000 from the eviction prevention. We also have the interest earnings in there. So we feel like maybe $2 to $2.5 million, somewhere in that range right now. Some of the bigger categories in the county expenses, which I didn't cover, there's a large amount in testing. Testing billings are delayed. So that's kind of a guess at this point. And also the state is paying for some of those. So it's kind of hard to get an exact figure on that. You can see we have $2 million left over for post-compliance next year. We feel we'll expend that. And again, the health department slammed right now, and there's additional expenses from some of our public safety sources as well. So.
Just quick follow-up. I understand that the city of Grand Rapids has additional eligible expenses. I don't know if other municipalities might, but I guess I'm a little concerned about just dumping it all back into the county when some of the other units, at least one of them that I'm aware of, could use it. So I put that out there.
Any other questions, Commissioner Talon?
That's it. Thank you.
Commissioner Skaggs?
Yeah, I just want to follow up on what Commissioner Talon said there. I think that we probably should make a decision as to whether or not the money that's going to come back from local government stays in that bucket and is distributed to those local governments that still have outstanding need, as opposed to taking them out of that bucket and putting them in the county bucket. If we can do that quickly, we still have time to get money out to those cities and townships that still have additional costs associated with COVID. So I think we should keep that there. And then the question about the 500,000 that is coming back from the city that was in the youth violence prevention.
You keep freezing up.
We lost you again.
I didn't quite catch it.
You totally froze. We couldn't hear your last part of your question. You're froze again.
Okay, so I mentioned the local government part. The second part was the violence prevention, and I didn't quite get it all.
You might have to put that last part of the violence prevention in chat because you just keep freezing.
Yeah, I have unstable internet. Let me
So
well, maybe we live in East Grand Rapids, Phil. That's probably why. Huh?
You need a hotspot, Phil? I think
I missed that joke entirely, Stan, as I switched. But you'll have to tell me later.
I have concerns because we did initially put 20 million for the fall surge. It was when we started looking at furiously hurrying up and allocating this money, even as late as September, we were thinking our numbers were good, our hospitalization was super low. Think we kind of have handled what we need. And that was initially we put 20. We've allocated all that down now to whatever's left over. And I have concerns about continuing to allocate this out. I mean, there's additional things that could come up that we can't even plan on. For instance, I know the hospitals are packed and they're desperate for care recovery centers. I don't know if that's something that the county might have to step up on in terms of making sure these folks don't go back to a nursing home and infect more. We might have to look at different and unique ways of caring for the homeless in the winter months, because they aren't going to be able to be congregated again in warming shelters and various things. So there might be things that pop up in these weeks seem like years, that I think it would be more prudent to hang on to this and ensure that we have what we need to cover the rest of the year. We don't have 20 million left like we thought we might need to hang on to. It's only a couple. So I would prefer that we additionally, if we were to reallocate these funds, it still now has to go through full board, which the next meeting isn't until December 3rd. And then we have to do any type of contracting or any type of agreements, and the money has to be spent by the end of the year. So I just think it's more prudent, considering we have a health department and we have the expenses coming, that we hang on to whatever remaining funds are coming back in. Really take these next couple of weeks to make sure that we're following up with everybody who were allocated money, make sure they're utilizing it to the best of our ability, be really proactive about that. But after that, I think we really need to wrap this up and ensure that we have enough additional resources for unforeseen problems. It looks like Commissioner Steck has his hand up.
Yes, thank you, Chair. I'm just going to follow up on that. Obviously, we're not going to meet all of the needs of our community. They're far greater than the pot of funds that we've had available now. And so we're doing the best we can under these circumstances. We do know that the application of these funds back to the county is a qualified expense. So we're clearly going to be in compliance with the limitations and restrictions under the COVID CARES Act. And my understanding is that if we do put and apply that to the county, it does not foreclose us from some flexibility later, because the monies are now within our budget, if we conclude to do something else with that. So it just strikes me that that's the most efficient and effective way of doing that at this point. And otherwise, you're right, we're going to end up having to push every timing envelope to try to do something here, and I'd rather do it in a more reasoned way than trying to do it last minute. So I think it makes sense to let it default back or apply it. I'm not sure what the right word is. Apply it to the county.
Okay, Commissioner Brevi, did you have your hand up?
Yeah, thank you, Chair. I would just like to move that we bring these funds that have been unused by our municipalities back to the county. And then we'll be able to distribute.
Would we do all unused funds for the end of the year to go back to the county?
Yes, that would be my preference.
Support by Ponstein.
Moved by Commissioner Brevi, support by Commissioner Ponstein. Questions or comments on that motion?
Yeah, this is Commissioner Steck.
Commissioner Steck.
Does the motion include the potential 540,000 to KCCA, or is that other than the 540,000?
I think that would be other than. It was Jeff's kind of proposal. So
Right.
All right,
I wasn't sure whether the 540 is already definitively, we've agreed that goes to KCCA or whether it's in that pot then otherwise.
It looks like Commissioner Talon's hand is up.
Yes, thank you, Chair. Just one more time, want to advocate for allocating dollars to the city of Grand Rapids. It's unclear to me why the county should have to have control of all those remaining dollars when there are certainly needs. The city has different responsibilities than the county does. And if they can document that they can use additional funds, I think we should provide it to them. Thank you.
Commissioner Skaggs.
Do we have, I guess this is a question for staff. Has Grand Rapids sent us that they would like and can use additional funds beyond what's already been sent to them?
I have not received anything from them. I did talk with Mark Washington a couple of days ago after their board meeting on Tuesday evening. He said that they would be sending back the 400,000 or the 500,000 that was tentatively allocated for their uses. So I have not heard back from them of additional needs, but nothing directly, nothing in writing, no emails.
Okay.
All right, so we have a motion and a second. Do we want to do a roll call? Pam?
Sure. Commissioner Scott,
Yes.
Commissioner Reedy,
Yes.
Commissioner Jones,
Yes.
Commissioner Ponstein,
Yes.
Commissioner Skaggs.
Was that me? I'm sorry.
Yes, Commissioner Skaggs.
Oh, yes.
Commissioner Talon,
No.
Commissioner Womack,
Yes.
Chair Bolter.
Yes.
That motion passes.
Okay. With that motion, I guess I leave it back to staff. Do we need to have an additional CARES meeting in December? I don't know if we have auditing issues or an audit that we need to approve or any type of, other decisions beyond allocating funds that we need to do. Happy to do it. I have asked staff to come up with, once we get through the year and we have some hindsight, to provide a report. We probably won't get it until January or February, to kind of lay out what we were able to do as a county for this community in terms of the CARES funding we did receive. Everyone hold your breath because we might get more CARES money. Who wants to volunteer to be on it again? Anyway, so there might be additional CARES funding coming in. It might not be called CARES with a new administration. So we'll see what comes through that way. But I don't know if we need to meet again in December or not. And I would leave that to staff and kind of leave it up in the air as needed.
Yeah, I was going to say, Madam Chair, if there is an absolute need, I would recommend that we depend on you to tell us whether or not it would be needed. But at this point, I don't believe so. I think we can communicate via email for reports like we do on a weekly or bi-weekly basis. And but if we need to have it, and I know Jeff, you're there. If we need to have it, you got to speak up, and your team speak up.
Right now, I don't see the need, but you never know. But right now, I think we're good.
And did we approve? I know we had to pass some funding requests, but did we approve an audit, or did we approve some sort of process for this to kind of review all of these grantees? And
yes, we hired Plant Moran. Jeff, you want to talk about the process?
Yeah, we hired Plant Moran. They've been working alongside us, assisting with some of the auditing already. We're getting the standards together, which will determine the testing for the single audit. And that money is set aside in the post-implementation line item of the county expenses.
okay. Any other, what else do we need to, is there anything else we need to review? Are we back to the agenda?
Yes, we're back, Madam Chair. I think, Jeff, you've talked about all the issues and items that needed to be talked about, I believe. Are you set? I think you were going to talk about the deadline, the calendar. Do you want to talk briefly about that? I don't know.
Yeah, not a lot has changed. 12:30 is still the deadline for spending. So far, we've not heard any word that they'll extend it. Until that point, we're meeting our quarterly reporting needs through both the state of Michigan and also the federal system. And we'll continue to report out through every quarter through the end of, or actually through 9/30 of 21, I think is the last reporting structure for this particular funding source.
Additionally, we don't have to go back on the screen, but it kind of went hand in hand with the funds that Grand Rapids declined yesterday. We did additionally provide that $500,000 line for youth violence prevention. And I know those grants, can you speak to that a little bit, Wayman? I thought a press release was going out today in terms of who is receiving those. Do we have an update on who those folks are and what organizations?
Yes. Sure. Linda, can you speed wrap that pretty quickly? Tell us where that's at. I know there's a press release coming out, but give us an idea.
Sure. I don't have the spreadsheet right in front of me, but what happened was we got in quite a few applications. I believe it was 16. They were all reviewed by a committee. Each committee member scored each application. The scores were averaged, and we literally started at the top of the sheet and worked our way down until all of the money was allocated. It's various nonprofits throughout the community who have come up with some good ideas about how to spend the money to try and reduce the crime in the city. And those recipients were notified, I believe, yesterday that they have been awarded their funds. The grant documents are either in their hands already or on the way. So we're set to turn that around and get those funds out ASAP. And then they can do everything that they can do to help this community get through this crisis.
So the total number of recipients, I understand, Linda, are 7. I believe numbers are 5,000 to 150,000, depending upon what the grant requests were.
Correct.
And I think that's, yeah.
And a couple of, and just for transparency's sake, a couple of the requests did get a little bit of reduction just because they requested things that were not CARES eligible.
Right.
That was the only filter that the staff put on the applications.
Yeah.
Once the review committee took a look at it and gave their scores, then we still had to make sure that everything that was requested was in fact CARES eligible. So a couple of the applicants that did get funded did not get 100% of their ask just because they were asking for things that were not for CARES funding.
And that press release hasn't went out yet, correct, Wayman, or has it?
I thought I saw something this morning. Lori, are you online?
Can we make sure that everything is posted to our website always so that people can access that as well?
Yes, ma'am.
Thank you.
For your information, the people that will receive funding or are in the process of receiving funding include the Boys and Girls Club, New City Kids, the Urban League, YMCA, the Edge Urban Fellowship, Bethany Christian Services, and Muse Ed. And all of the grant agreements are out to the recipients for them to execute and get back to us.
Yeah, Madam Chair, the press release went out late yesterday afternoon, I believe.
Okay, I haven't seen it either, so.
We'll make sure you get a copy of it.
Well, we just need to make sure that the public sees it and they know what's happening. There was a lot of confusion. There was a lot of, sorry. There was a lot of confusion since they were the same dollar amounts and they were going to the same geography, that the 500,000 and the 500,000 and what it's going for. So I think we really need to be proactive in terms of clarifying we did both.
Okay.
Pardon me?
Yes, I said, okay, yes, we'll make sure.
So I just want to be upfront with everyone that there was an additional $1 million put up. So thank you.
Bye.
All right. We are at number 4, public comment. There is an email address, publiccomment@kentcountymi.gov. I've seen quite a bit of chat activity. If you are on virtually, please raise your hand and I can call on you. If you would like to send an email, that's great too. If you would like to contact your commissioner directly, I would encourage that as well. But we are now on to public comment. Pam, is there anything in the email inbox?
I just checked and it is empty.
Okay.
And I don't see any hands raised in the chat.
I don't either. Oh, I see one. Unfortunately, I don't have a name, ELS Jex. Can you please give us your name?
It's Elsha.
Okay.
I just wanted to,
Address, please.
I live on Hawthorne Street in Grand Rapids. I just wanted to thank the commissioners for listening to what I've already said, and reiterate the need for a state of emergency through the holidays, if that is something that the COVID Relief Committee could think about. I know there isn't a relief committee necessarily for the city of Grand Rapids, but it is a need that I have heard expressed many times. And I think that is part of where the frustration with COVID funding going to technology right now, because there are a lot of people struggling, and I respect the work that has already been done by the county, but there is a huge need, especially as we go into winter, for expanded testing and direct relief to citizens, and essentially shelters that will be over capacity, especially with buildings closed, including the libraries, and there will be a need to have direct relief to them so that we can prevent hundreds of deaths. Thank you.
Thank you. Looks like someone from East Hills Council of Neighbors had their hand up.
Yes.
Can you give us your name and address, please?
I typed it in the chat. My name is Maggie Rivera from 257 Warren Avenue, Southeast Grand Rapids, 49506.
Thank you.
Thank you for allowing me to comment today. I'm coming from a perspective of community, and I'm seeing some community in action here, community collaborations in action. So thank you for the opportunities for these dollars to go to whether we're in county or city. The recovery process is going to be a long one, and I hope that our commissioners, each one of our commissioners, and not just the commissioners that live in the city and do their work primarily in the city, but all commissioners can come to a point to understand that we are all in this together. What happens in the city affects the northeast corner of our county and vice versa. What I'm seeing here between the city commission and the county commission is a bit concerning, because I know that there are ongoing relationships developing and growing and changing between the two governing bodies. However, the people with the most need are the ones falling through the cracks, not the commissioners and not people from certain levels of income and class. So I say that because unfortunately, it seems to be a disconnect between the conversations and needs of the city and the conversations and observations or needs with the county. These dollars going into a general budget is concerning to somebody who pays taxes. I would hope that the commission would go a step further and stay committed to and put it in writing that those dollars that are, as I'm not sure what the word is, but I'll just say absorbed back into the general budget, are actually earmarked, tagged, and restricted for COVID. Having served as an elected official, I do see that there are opportunities and needs that could go in very different directions than serving your most needy in your county. I'm not saying that the city most needy are more important than the rural most needy, because there are opportunities all over our county to get those dollars in the hands that need them, including, as stated by the prior public comment person, rent assistance, food assistance, healthcare assistance, all kind, burial assistance. There are all kinds of opportunities. Thank you.
Thank you, Maggie. Thank you for joining us today. And I really hope that you will continue to stay involved and review what we have done. It's been a very long, very long process with hours and hours of subcommittee meetings. So thank you so much. Is there any other public comment today? I just lost my chat. Hold on. I don't see any. Oh, Ellen Martin.
Hi, my name is Kellen. I live in Grand Rapids City, Lion Street. It's very nice to be able to talk to all of you and see all of you doing the work that needs to be done for the community and whatnot. So thank you for that. I appreciate it. I just wanted to raise my comment about, I guess maybe it is a question about how, so the $500,000 that was originally earmarked for crime prevention was going to be going to GRPD and or figuring out their monetary funds for the rest of the year and whatnot. And then the council voted, or the commission voted that down. I guess so. I'm wondering, so there is already 75, I'm pretty sure, $1,000 within city coffers that allows, that is saved up for the cure violence methodologies or program that also the commission has been seeing about possibly implementing into the community. I'm wondering why the $500,000 couldn't have been applied towards that. I guess I know that it is, you know, they were making the assumption that like, oh, they couldn't spend the money fast enough, but that seems kind of weird because I feel like, you know, we could definitely, if we were all in agreement, we could, I don't know, find like a bank account to put it in, i.e. spending it, and then, you know, kind of getting that money going for that. So I'm just wondering where kind of the disconnect between Cure Violence program and why the money didn't go to that specifically.
Thank you. Commissioner Talon.
Thank you, Chair. Just wanted to clarify for those that are participating from the public in this meeting that the money that we reallocated into the general county bucket is not going into the county general fund. It is COVID dollars that has to be spent on COVID related expenses. So it's not going into the general fund bucket for the county, but within the CARES allocation, it is going back into the county expense bucket. So just a clarification. Thank you.
Any other public comment today? All right, seeing none, can we go back to our agenda?
Sure.
We were on miscellaneous. Do we have any commissioner miscellaneous today?
Chair Bolter, this is
Sure,
Commissioner
Commissioner
Stepp. Just a question about what's the means by which we will be kept informed on how these programs that we're funding are going to be implementing those dollars and the results from those programs. I know that we put 9.5 million through the United Way into the private sector, into the nonprofit sectors, and now another 500,000 into violence prevention programs. So presumably there'll be some reporting protocol for them back to the county, and just looking for some insight from Wayman and others as to how you're going to spend that, send that information and that performance reports back to us.
Yes, staff has been very busy, Commissioner, working on since the last meeting and talking with Chair Bolter to prepare for this committee and the board a very detailed report on all of the dollars that are allocated and how the money's spent. So we will be providing that as she communicated earlier. I will I will continue to provide a weekly or bi-weekly update to you as well, with an overall high-level update, but we will have a much further detailed report towards the end of the year or beginning of the first of the year. That's what we've talked about.
Yeah, particularly, thank you for that, Wayman, and particularly this this most recent allocation of 500,000 on the violence prevention.
Yes.
We know that those monies have to be spent out under current COVID CARES rules by the end of the year. So we would hopefully see some some results from those, because I don't really, I know that we have 5 or 6 recipients. I really don't know what the nature of those programs are in specific, but we look forward to reporting in more detail on that.
Yes, sir.
Commissioner Womack.
Yes, I'd really like to thank everyone that called in for public comment today. And really thank those that listened into our first meeting earlier today with the Board of Commissioners as a whole. Thank them for joining in on our subcommittee meeting, and having a chance to hear the concerns of where funds are going and making sure, which we definitely would do with our great staff and our legal counsel and our chair as a guide, making sure that they go through for coronavirus related issues. I'm just very happy that they had a chance to tune in, because as Maggie said, sometimes the messaging that comes between the county and the city is a little different to the public, and it causes a lot of confusion. And as I watched the city commission meeting, you know, as our chair said, there was $1 million that was put up towards Stop the Violence, and $500,000 went effectively immediately to programs, which was something that our chair wanted to make sure we did first in all of our commissioners of those programs. So I'm just glad I got a chance to hear from the public comment once again and wrote down a lot of their concerns. And I do look forward, because I know with 3 minutes, you only have so much time to talk to us commissioners. Once again, I hope you reach out to some of us by email, especially myself, when we're talking about some of the most vulnerable areas, because it'd be good to have a chance to talk with you sometimes even before the meetings, so we can continue to be a voice for you and the public here at our Board of Commissioners meeting. But once again, thank you. And I've been just grateful to be on this subcommittee and have a chance to see firsthand the millions and millions of dollars that were poured into the county, and especially into the city of Grand Rapids, on top of the $6.4 million we gave the city of Grand Rapids. So they have some options within their own budget to fund a lot of the programs that are coming to them. And I'm just very thankful that the county saw all of the life that was lost due to COVID-19 in those vulnerable communities, all of the life that was lost to the uptick of crime in that area, for going overboard to help the city of Grand Rapids when it comes to saving lives. Thank you very much.
Thank you, Commissioner Womack. Any other commissioner miscellaneous today before we wrap it up? I don't see any hands. No one in chat. All right. If this is our last meeting, I'll try to keep it brief, but I want to thank the staff. It was not easy. This was not an easy year. It was tough in general to do the general duties that needed to be done, to take the extra precautions on the safety measures, and then all of a sudden to be thrust into this subcommittee and trying to figure out, get our arms around this community and figure out what the essential needs were first, which we did. That was the first, I believe, 2 or 3 meetings, and work out from there. So I want to thank the staff. I want to thank my fellow commissioners. I think I asked you to get on this subcommittee and you probably had zero clue what was involved, and it's been hours and hours and hours. We've had meetings that we don't even want to remember, where we sat for 4 and 5 hours in one meeting. So it was very intentional. We put the word out, we listened, we did a lot of listening, and we did what we could do to the best of our ability to address the essential needs at the outset: homelessness, food assistance, PPE into our neighborhoods. And so I just want to thank you all. I want to thank the public and especially the staff. So with that, do I have a motion to adjourn?
Motion to adjourn.
Moved by Commissioner Womack, support by Commissioner
Onstein.
Onstein. We are adjourned. Thank you so much.
Thank you.
Thanks, Mandy.